Hi, I am Dr. Terry Mason. I am your host for Live Amazing. Joining me this morning is Ms. Sadia Selvey, and we're going to have a conversation about Medicare. So make sure that you let someone know that we're having this conversation this morning, because Medicare is a very confusing sort of subject, and we want to make sure that you understand it. So we're going to start with some very basic information, and Ms. Selvey is going to walk us through a few things. So the first thing, what is Medicare?
So Medicare is a program that most people pay into while they're working. And so Medicare basically provides insurance once a person turns 65 or another type of special type of situation happens in their life that requires them to have Medicare. And so it's a federally funded program. Most people will have deductions, tax deductions taken out of their checks for Medicare. And so once they become eligible, we'll talk about the different parts that they're eligible for. But it's a federally funded program.
Now, do you pay into this? Is that right? And if you do, how much and how long?
Yeah, so most people actually pay into Medicare. Once you've paid into Medicare for at least 10 years or 40 quarters, you've earned your Medicare rights or Medicare benefits. And so what that generally does is once a person becomes eligible for Medicare, they get Part A premium free because they've paid into Medicare and they've met the qualifications in terms of no monthly premium. But then for Part B, typically there is a premium associated with Part B once a person becomes eligible for Medicare.
So eligibility is a function of age and time you've paid into the program. Is that right?
Well, no, but that is, most people do think that you have to be 65 in order to get Medicare. So there are other situations or circumstances whereby someone becomes eligible for Medicare. So as you mentioned, the first way is that you turn 65. Mm-hmm. And so most people receive Medicare as they age and turn 65, and they've worked enough quarters or years where they've paid into Medicare where they become eligible. Some people earn it as a result of being a spouse of an individual who worked or qualified for those quarters, and maybe they did not qualify for those quarters or those years, but they have to be married to that individual for a certain amount of years. And then there are people who qualify outside of being 65, such as anyone who has a Social Security disability. They would qualify for Medicare in the 24th month after they've been deemed with this disability through Social Security. And then there's another population of individuals who have ALS or Lou Gehrig's disease, and they qualify for Medicare. And then anyone who has end-stage renal disease, where it requires, or permanent kidney failure requiring dialysis, at any age qualifies for Medicare as well.
So there's a lot that people need to understand. And recently I went through this myself, trying to get through the application process. And it's a little onerous, but you get through. You get through. And I want everybody to know you will get through. So in terms of Part A, what's the difference between Part A Medicare and Part B?
Yeah, so Part A and Part B are what Medicare calls original Medicare. And so when a person becomes eligible for Medicare, and oftentimes they become eligible for Part A and Part B. So Part A, as we mentioned earlier, is premium free, and it's something that they automatically receive once they become eligible for Medicare. Part B is premium. It has a premium that's related to Part B. And the difference between the two, think of one as inpatient and the other is outpatient. So A, think of it as your inpatient benefits. That's the easiest way to think of it. Mm-hmm. Part B is your outpatient benefits. So Part A covers things like inpatient hospital care, skilled nursing care, home health care, hospice care. Those are the 4 basic benefits that Medicare Part A covers. And then your Medicare Part B is outpatient. So think of doctor's visits, specialist visits, emergency room on an outpatient basis, urgent care, those things that you would do on an outpatient basis in terms of your medical care.
Now, just to be clear, it doesn't pay 100% of those costs or charges?
No, and that's the most important part of Medicare that I think that people should understand is the out-of-pocket costs associated with Medicare. Remember, when Medicare was created, most people, once they retired or became eligible for Medicare, and really around retirement age, normally retired with some type of group coverage. And so Medicare was supposed to cover you, but then also took into consideration that you had retirement benefits. And for individuals who did not gain or have retirement benefits upon retirement, would pick up things that are called Medigap plans or a supplement plan, because it was to cover the gaps in Medicare. There are a lot of gaps in Medicare in terms of out-of-pocket costs. And so those things you should definitely be aware of. Medicare Part A has a deductible for hospitalization. If you're in the hospital for over 60 days, there are co-pays, daily co-pays associated with that, and there's no stop loss. So you could continue to pay for those out-of-pocket costs under Medicare Part A, and it could get really, really, really expensive.
Really? How expensive could it get? When you say, you mean you didn't end up paying those daily charges that the hospitals charge after a certain period of time?
After a certain period of time, you have a co-payment amount. And I'll tell a quick short story. I sold Medicare Advantage plans a number of years ago, and I walked into a gentleman's house and there were boxes everywhere. So I assumed he was moving. And as I sat down and talked to him, I said, "Oh, so I see you're moving." And he said, "Yeah, but it's not by choice." He told me about a hospital had put a lien against his home because he had a stroke and he was in the hospital for over 3 months. And the cost that was associated with his Medicare, they ended up putting a lien against his home because it was thousands and thousands of dollars. And so he was moving out of his home. And at that time, I didn't know that the hospitals could actually do that, but it made me, it literally fueled my passion to educate people about the out-of-pocket costs associated with Medicare, because a lot of times when people become eligible for Medicare, they don't know that all of these gaps or costs are associated with Medicare.
So these costs were associated with the days beyond what Medicare would pay for? Or
it's just the regular out-of-pocket expenses
the copay kind of thing.
Right, under Medicare, because your deductible is over $1,200 on day one of any hospital admission. And then Medicare actually tracks your benefits by what's called a benefit period. And it's a 60-day benefit period. So let's say you went into the hospital for 3 days. When you come out of the hospital, Medicare will count, and if you are not, count 60 consecutive days. If you don't go back in the hospital within that 60-day period and you were to have another hospitalization, that's a new benefit period. You would pay that $1,200+ deductible all over again. If you were, let's say, did not, meet that 60-day period and you went back into the hospital, let's say on the 56th day, well, on the 61st day, you're going to start paying a co-payment amount every single day that you're in the hospital, and it's upwards of $600-700 a day. And so that's how he accumulated all of those costs, because he was in the hospital well beyond those days.
This is amazing, because most people, I didn't know that could happen, that
Yes.
you'd end up with that sort of thing. And I think most people don't know. So I think it's really good that we're saying that Medicare doesn't pay everything
Right.
for everybody for all the time.
And every year, Medicare posts what they call cost at a glance on Medicare.gov. So if you go to Medicare.gov and pull up cost at a glance, it will tell you all of your out-of-pocket costs associated with Part A and Part B, as well as your premiums. If there's a late penalty, it'll provide you with all of the estimated costs under Medicare.
Now, what is the Part B penalty? They talk about a Part B penalty. Can you explain what that means?
Yes, so again, when you become eligible, like you recently became eligible for Medicare, because you worked those 10 years or 40 quarters, you actually receive Medicare Part A premium free. So at the time that you became eligible, you automatically received Part A. Part B, you actually have to enroll into Part B. Whereas with Part A, if you've earned the right, then it's automatic, basically. With Part B, you have what's called your initial election period. And when you elect to enroll in Part B, and you do it at the time that you're supposed to, there's no penalty. But let's say you were still working and you retired, you had Part B, you're supposed to pick up Medicare Part B within an 8-month period after you retire. If you fail to pick it up and you allow 12 months to go by, you receive a 10% penalty for every 12 months that you did not enroll into Medicare Part B. So there is a penalty, and it's a lifelong penalty. So as long as you have Medicare, you will pay that penalty.
Wow, that is amazing, because what I learned as I was going through this, that I did get the card in the mail for Part A all by itself, as you mentioned, and then for Part B, there was a process that you had to go through, which included, and I applied during the pandemic, so I couldn't go into the Medicare office and talk to somebody because I didn't know what I was doing. But at the same time, they set up a phone conference for me to speak to a Medicare person or Social Security person who helped walk me through that. So our listeners or viewers should know that there's work they need to do to make sure they stay on that. So that election, that making certain that you apply for your Medicare as soon as possible, as soon as you're eligible, I should say, is very important.
It's extremely important. And let's just say someone did miss their initial election into Part B. They can actually enroll during what's called the general election period. And that period is from January 1st to March 31st of every year. In the event that they did not enroll when they had the opportunity or when they were eligible to enroll in Part B, they can actually enroll in either or, Part A or Part B, during the general election period, January 1st to March 31st, and then their Part B will become effective July 1st.
So what we're trying to make sure people understand is that just because you have Medicare Part A and Part B, your worries are not over. You still are on the hook for your cost to see your doctors and to see or go into the hospital. Is that right?
Yes, that's correct.
And you have copays that you have to pay.
Yes, copays, deductibles, coinsurance, yes.
And those things could be formidable.
Yes.
Now, how would I know what those things are? Do I just have to go and then wait for a bill to come?
Most people do receive the Medicare and You book. In the Medicare and You book, it typically will explain how Medicare works, what your costs are that are associated with Medicare. And then if every year it changes, so your deductibles, your co-insurances, co-pays, your co-insurance, not your co-insurance, but your co-pays and your deductibles go up every year. And so, like I said, on the Medicare.gov, there is what's called cost at a glance, and it'll tell you what your out-of-pocket costs are on an annual basis.
Well, speaking about cost at a glance, one of the things that was sort of interesting is that you have to pay for the Part B, and they deduct that right out of your Social Security check. Now, how do you know what those costs are, or are they set, or is that something you talk to somebody about?
It's a set cost based on your income amount. So depending upon how much income you made, if it's under $80,000, it's a standard premium. But if your income as an individual goes above and beyond that, then Medicare will set the amount of that premium based on your earned income.
Well, that explains why I got the shock of my life when I got my plan, because my brother, who's older, he says, oh, it's only $144. So I was looking for a $144 bill, and when I got it, I was like, oh my God. So I had to go call them up and find out, and then they sent me a slip that said, oh, well, here's what you earn. They sent me the whole thing. And they said, because you earned this, you got to pay that.
Right. So your premium was much higher than your brother's.
Yeah, so I think that I say that for those people who are listening and watching and have other people or friends that have gone through this, you need to get the information for your particular situation.
Yes.
You can't go by what other people are doing, which is why it's really important. Now, when can you switch Medicare plans, or are there different enrollment periods for Medicare, or do you just enroll when you become age eligible?
Most people become enroll when they become eligible for Medicare. It could be based on their age. It could be based on them qualifying for the Social Security disability, where they automatically become eligible in the 25th month. If they have railroad retirement benefits, these are all qualifications, or if someone is diagnosed with kidney disease and they're on dialysis. So it just depends on at the time that they become eligible, that's when they would enroll in both Medicare Part A and B. The only time that someone would delay, like Part B, is if you turn 65 and you decided to continue to work. Medicare does not require you to enroll into Part B at that time. You will automatically receive Part A if you've earned it, but your Part B, you'll actually enroll into Part B upon retirement. Once you retire, the day that you retire, you have 8 months from that date to enroll into Part B without a penalty.
You know, it's really important. This is a very important point, because if you've never had Medicare, you don't know anything about it, and you're working, you always had, as you mentioned earlier, insurance through your job. And then when you retire, you maintain your insurance through your job. Are you still required, after you're retired and you're past 65, are you still required to get Medicare, or can you just use the plan that you have from your job?
Most employers will require you to pick up Medicare, because at the time of retirement, Medicare will become primary and your employer benefits will become secondary.
Now tell us what primary and secondary mean.
Yes, so in the situation where you go to the doctor, in terms of the claim being paid, Medicare will pay first, and then your employer plan or your group insurance will pay second.
Ms. Selvey, this has been a great conversation, and I'm learning a lot again about this. And if you have any questions, please feel free to call us at 866-946-4458. So it's important that you do that. We want you to get that information. And you can always go to our website at myzinghealth.com. That's MYZINGHEALTH.com. So this is really important information. I can't, and I'm gonna tell you, from going through this, it sounds, but during a pandemic, I don't know if they've opened the offices back again, but it is a lot of work. You need to get the appropriate documentation together, and they'll tell you all the paperwork you need, and do what you need to do. So what is this Medicare Part D? What is Medicare Part D, and what is this this standalone? What is that?
So again, you have original Medicare, which is Medicare Part A and B, your hospital insurance, and then your doctor's insurance, the doctor's or outpatient insurance under Medicare Part A and B. But then there's Medicare Part D, which is your drug coverage. Part D stands for drugs. And so it's a way to also get prescription drug coverage, because Medicare Part A and Part B does not cover prescriptions on an outpatient basis, such as, obtaining prescriptions from a pharmacy. That would be your Part D benefit.
So that's important to know, because if you worked and you have some benefit from work, can you still use that with your Medicare or no?
Yes, so in some instances, beneficiaries will have coverage from their job, but that job has to, their employer plan benefits have to be considered credible coverage in order for them to waive Part D. So if their current employer plan benefits or their retirement benefits provide them with Part D or prescription drug coverage, they have to attest that it is credible coverage in order for them not to receive a penalty if they decide not to enroll in Part D when they have the opportunity to.
Now, if you're a veteran and you retire and you've worked and you retire, are you eligible for Medicare as well, or
It
no?
depends on the individual situation.
Okay.
If they are eligible for Medicare, sometimes they will have prescription drug coverage through the VA, and that is considered credible coverage. And so they may not necessarily have to pick up a Part D, a Medicare Part D standalone prescription drug program because they have credible coverage through the VA.
We're hearing a lot now about another program called Medicare Advantage.
Yes.
So what's the difference between what we've been talking about, which is regular Medicare, and Medicare Advantage?
So Medicare Part C or Medicare Advantage is just another way to get your Medicare A and B. I like to think of Medicare Advantage as a comprehensive plan, whereas with Medicare Part A and B, there's no prescription drug coverage. You don't receive, there are certain benefits that Medicare does not cover. And so under original Medicare, it does not cover dental benefits on a routine basis or comprehensive dental. It doesn't cover glasses outside of cataract surgery. It does not cover hearing aids. So there are a lot of things that Medicare does not cover. Under Part C is a Medicare Advantage plan. And a Medicare Advantage plan, what it does is it encompasses Part A, Part B, and most oftentimes Part D. And so Part C is a comprehensive medical plan that will include A, B, C, and D. You will get all of those benefits, as well as it will provide you with a stop loss or a maximum out-of-pocket cost, whereas with Medicare, there's no maximum out-of-pocket in terms of what you pay. Under a Medicare Advantage plan, that's one of the great things I love about Medicare Advantage plans, is because it does provide you with a maximum out-of-pocket cost or stop loss, where if you pay, let's say for example, once you hit $3,000, you're covered at that point for your medical care. And so that's important because with original Medicare, there's no stop loss.
So you'd have to pay those parts that we talked about earlier continuously.
You would have to, pay that, you will have that out-of-pocket associated with it. And I'll give you an example. Under Medicare Part B, you have a deductible that you have to meet every year. Once you meet that deductible, it's a 20% co-insurance for each service that you receive under Medicare. So that could be for your specialist visit, for your doctor's visit, for your lab work, or certain services like that.
Sure.
You'll have a 20% co-insurance associated with it. The only services under original Medicare whereby it's a zero copay is the preventative services under Medicare.
So these services that are now, so the advantage, let me put it that way, the advantage in Medicare Advantage is that you almost get like Part D thrown in. In other words, your drug cost is thrown in, and you mentioned hearing aids, some dental work. Those things are part of the Medicare Advantage plan, but not under the standard Medicare Part A and B.
Yes,
Is that correct?
That's correct. That's correct. And another thing that Medicare Part C does is it allows you to kind of budget, because you have fixed costs associated with most of your services, such as a copayment. A copayment is a fixed amount, whereas when you go to the doctor under original Medicare, you have a 20% coinsurance, and you may not know what that is until you receive the bill.
Oh my
but
God.
Under a Medicare Advantage plan, normally the costs are fixed, such as a copayment of a $10 copayment, a $5 copayment. And with Medicare Advantage, it depends on the plan that you join. They provide additional benefits like vision, dental, hearing. You could get fitness benefits under there, prescription drug coverage. And with some Medicare Advantage plans, it's all at no cost. Some Medicare Advantage plans have premiums associated with them. They can be anywhere from a HMO to a PPO to a point of service. It just depends on the plan.
And you can sometimes get transportation to and from
Sometimes,
your...
yes, depending upon the Medicare Advantage plan that you enroll in, the benefits could vary. But I think of Medicare Advantage as a comprehensive plan that will cover all of your care as opposed to just some of your care.
There are, and we'll be talking later, because some people may have Medicare and Medicaid.
Yes.
And they have probably Medicaid for other reasons
Yes.
that we won't get into here. But how does that work? If you happen to have Medicaid when you get Medicare, how does that work?
Yeah, so that's called being dually eligible. You're eligible for both Medicare and Medicaid. And depending upon the level of Medicaid that you qualify for, it could cover you for things such as your Part B premium. So it may cover the cost of your Part B premium. The Medicaid, yes. The Medicaid could cover your Part B premium. It could cover your Part B premium, your co-pays, your deductibles, your co-insurance under Medicare, and reduce your Part D prescription drug costs. So it will provide you with what's called extra help sometimes if you qualify. And extra help will really bring your co-pays and your deductibles and your premiums for Part D down to either a minimum or no premium. It just depends on the level that you qualify, and it's all income based.
You know, this has been an amazing conversation, but what we want people not to worry about is remembering everything we just said. So you can always go to myzinghealth.com. That's myzinghealth.com, and or feel free to call at 866-946-4458 to get more information, because we don't expect you to remember everything we just covered. That's a lot of information. I didn't know it when I was going through it. And there's a lot that you have to do. And if this is all new to you, this whole process, which is why you can go to the website, myzinghealth.com, or make the phone call to the 866-946-4458 number, because I'm going to tell you, you're going to need some help.
Absolutely.
You know, you're going to need some help. This is really important, and you want to get it right the first time out the gate. And you want to understand these differences. You want to understand the difference between just Medicare A and B or Medicare Advantage, so that you could decide which one works best for you. And there are some times that you can do these things. Is that right? That people should know, and you can always call and get it, but there are times where these enrollment periods open.
Yeah, so one to really take note of is when someone initially becomes eligible for Medicare, they are in what's called their initial coverage election period. So what Medicare does is they give them 3 months, a 7-month window to enroll into either a Part D plan or a Medicare Advantage plan, a Medicare savings plan. They can actually enroll, and they'll have a 7-month window to do that. So it'll be the 3 months before they become eligible for Medicare, so they can enroll during that time, the month they become eligible for Medicare, and then 3 months after. That's called a 7-month window for them to pick up any additional coverage that they may need, like a Part D plan or a Medicare Advantage plan. And so that is that initial coverage election period where Medicare will give them a 7-month window to enroll. If they happen to miss that enrollment period, they have what's called the annual election period, which happens every year from October 15th to December 7th. And so that's the period where they can pick up a prescription drug plan, a Medicare Advantage plan, or coverage for enrollment that will start January 1st of the following year.
So that's a lot. That's why we want you to go to the website, because we have people that can help you navigate that, or you can call us at 866-946-4458 to get that information. We don't want you to miss the opportunity, because there's significant problems when you do. And we don't want you to miss that, because we want you to, you've earned this. These things are things you've earned, but you need to understand what you need to do. And Medicare.gov has a nice website where you can
Absolutely.
get a lot of information.
Great information.
Great information. And now you can go online and get your Social Security situation, understand what's going on, apply, and a lot of these things you can do. So it's real important. And I want to thank you so much, Ms. Selvey, for joining us on our program to talk about this. So remember, go to myzinghealth.com for more information or call 866-946-4458. And I hope that you found this to be helpful. So thank you so much for watching.